Hey, welcome everyone. Today we are going to discuss irritable bowel syndrome. Irritable bowel syndrome is a common clinical entity, and that is generally regarded as a disease of exclusion. So let's discuss regarding irritable bowel syndrome. We'll discuss the pathogenesis, the diagnostic features, the morphological changes, if any. So please stay tuned till the end of the video. We are going to have great learning. Irritable bowel syndrome is a clinical syndrome purely, and it is a chronic relapsing abdominal pain that lasts for 3 days per month for more than 3 months. So remember, 3 days per month for more than 3 months. So this is the clinical criteria, and the patient experiences changes in the bowel habit. Blotting and flatulence is a constant feature, and the patient responds with some psychological support, with antidepressants being given to some of them, and with fibers also. It generally responds, the patient responds, and it changes. Clinically, it is most commonly seen between 20 to 40 year of age, and most commonly females. And the females, they are having some features, clinical symptoms like fibromyalgia, backache, headaches, dyspareunia, depression, some stress related factors are there. And another important feature is why I was telling it as a diagnosis of exclusion, that the histology will be absolutely normal, and a normal fat absorption test will be there, normal bacteriological test will be there, stool, urine, everything will be normal. So everything will be normal on investigations, majority of the tests will be normal, but still the patient will experience those clinical entities, so will not be able to reach to any morphological diagnosis. So it's just a clinical diagnosis by excluding all the factors. And stress, depression, workplace related issue, some other coexisting disorders, they are known to precipitate irritable bowel syndrome. CNS hyperactivity, genetics, so it is commonly seen in familial in cases, are more in irritable bowel syndrome. Stress, irritants, abuse, depression. So these are the known, these are some postulates of irritable bowel syndrome. So we should need to identify the exact factor that is there in the patient, and that can be prevented to reverse the signs and symptoms. Patient's history need to be taken properly. Clinical symptoms need to be evaluated, and stool examination can be done where there is a negative stool examination for any kind of a bacteria, and we can do a Clostridium difficile toxin evaluation. Any stool microscopic examination for ova and parasites needs to be done. Endoscopy can be done, sigmoidoscopy appearance, that will also be normal. Histology of rectal, multiple fragments of intestine can be done with endoscopy, like rectal, colonic, small intestinal mucosal biopsies can be there. And virtually most of these investigations will yield no results, so everything will be normal. It's just a clinical diagnosis which is postulated because of some genetic factors, CNS hyperactivity, and some stressful factor. So that's all about irritable bowel syndrome. Hope you had a great learning. Thank you, and bye bye.